basically he will come in, introduce himself, ask if you have any further questions. If you don't have any further questions, he will then take her to a procedure room. They'll be in the procedure room. Usually it's about 5 minutes. Bless you. Most of the time that they're in there, they are waiting for the numbing agent to take effect. Once that occurs, then he will go across and release that frenulum with cautery. The way cautery works is as it goes across, it kind of seals as well. Do bring a blanket that day, just because they like to kind of keep her cuddled in that. As soon as the procedure's over, he will bring her directly back to you. Okay. After the procedure, she'll be numb for about 45 minutes. After that, they're usually kind of fussy, and they can be fussy those first couple of days. Okay. See. If it is time to eat, she can feed immediately after the procedure. There's no issues with that, and otherwise continue on with normal feedings. Okay.
Okay.
If you feel like she's a little extra fussy or having pain, there's a few things that you can do. One of them would be Tylenol. And I can give you a dosing chart if you don't already have one. But basically that's all dosed off her weight, and you can give Tylenol every 4 hours if needed. The other things that we recommend, and they're more homeopathic, is one of them is Highlands All Natural Teething Gel. That is works very well, and then the other one is Arnica, and that is a homeopathic pain medication, or yeah, basically pain medication. And it is kind of like pellets, and you dissolve those in like 1 to 2 tablespoons of breast milk.
Okay.
So then I have that written down, so that way sometimes if you're not familiar with Arnica, it's hard for you to like know what you're looking for.
Can I get that at like Sprouts or?
Okay. You absolutely can. Yep, I've actually seen it at Sprouts. I've looked. I tried to look for where things are for our patients as well. So.
Okay.
But yes, I have actually seen it at Sprouts. So that's kind of the first couple of days, and how to work with like kind of pain management and that kind of thing with her. Otherwise, continue feeding as normal. We do follow up with you about 10 to 14 days after the procedure. We're basically looking to see how is feeding going, is there any reattachment, and how things have been going since the procedure. It is a procedure, so a couple things that we let you know are possible complications, one of them being bleeding and infection. Neither one of those have we had any issues with, but we do let you know it's in a procedure, so it's a possibility. The other one is reattachment, means it heals itself back together. Some of that you really can't, you can prevent, some of it you can't. It doesn't happen all the time. Most of the time in research it's about 2 to 5% of the time. So, but it is a possibility. So ways that you help prevent reattachment is doing some of those mouth exercises, and I think Valerie
probably she sent me the email.
Perfect. So there is the fun ones, which we definitely want you to do, kind of that playing with them, that happy look on your face, touching their lip, getting them to stick their tongue out, open their mouth. You can also let them stick on your finger to kind of get them used to your finger being in their mouth. The other thing that you're going to do is kind of what I consider the not so fun ones is you're going to take a clean finger, and you can do either 1 finger or 2. You're going to dip it in coconut oil. That's going to act as a lubricant and also just kind of has some healing properties. You're going to take that clean finger, and you're going to run right across underneath the tongue, right along the procedure site. And you're going to do that for about 4 to 5 seconds, kind of like a window wiper going right across, okay? And then you're going to lift up. The other way to do it is dipping both fingers in coconut oil, and then you're going to go from the outside in, okay? And then you'll lift up, okay? So those are kind of the 2 options. Whichever one is fine. Just make sure that you are getting under there for about 4 to 5 seconds at a time, and then you're going to do that 3 to 5 times a day.
Okay.
Okay. We talked about follow-up. We talked about procedure. What questions do you have?
Nothing. I just more want to see if it's something what it is, and if it is, it explains a lot, because she is very, very colicky.
Okay.
She does cry a lot. She's very gassy.
Okay.
And if this is what the issue is, then that explains a lot, and it will make me feel a lot better.
Yeah. Sometimes with her age, her being a little bit over a month, sometimes you need to work with them a little bit afterwards to kind of get them feeding correctly, because they've been feeding incorrectly for a while. So just kind of have that in mind as well. You saw lactation result in you saw Sarah, is that right?
Yes.
So, so that too, sometimes lactation consultants will want to see you like 4 or 5 days after. You can always talk with her and decide what she would like you to do.
Okay.
Okay. This is the written what the actual exercises are. And then on the back page here, it talks about the Tylenol and the arnica and that.
Okay.
Okay. Grab some gloves and we'll take a look.
Am I gonna put her on the table?
Yeah.
Oh, you're okay, sweetheart.
Hey, Pumpkin. Listen to your heart. I know. Hi, sweetie. Alright, so first we always look at the top, the upper lip. I know. She definitely has a lip tie.
Okay.
You can see how it kind of indents in here, kind of
Like
wraps
pockets
around
and
the
stuff,
gingiva or the gum.
Mhm.
And then, yeah, hers is pretty tight. I mean, I can't
Yeah.
really get her lip to
And it usually makes
flip
her
up.
uncomfortable
Yep,
when I try to
it
look.
does. You can kind of see that connection spot is right here. So it's definitely, and there is definitely a pocket under there. I don't want to cause too much pain for her. So, and then just kind of looking at her tongue, I know she does have some extension.
Mm-hmm.
What you notice is when she pulls it back,
It's heart shape.
she does have that heart shape. So what makes me wonder is, and if you can kind of see how her tongue is a little bit more squared there
Yeah.
as she pulls it back. So that usually kind of lets us know that there is a possibility of a tongue tie. She's got a really deep upper palate. I know.
Because I have
So,
videos of her
yeah.
latching, and you can't see the tongue on the sides
Underneath
of her lip.
Yeah. So here's her tongue tie. What she has is a more posterior. You can kind of see right in here. I don't know if you can see it from that angle. But
Yeah, I can see
okay.
it.
I know, sweetie.
So is that it's connected more wider than it is deep?
Hers is definitely, we have like this kind of what we call subcutaneous band.
Okay.
So it's just kind of like this band of tissue that's kind of toward the back of the tongue. That then the frenulum is kind of in the middle. So as he goes across, he'll go across that subcutaneous tissue and the frenulum for hers, because hers is more posterior.
Which keeps her from being able to curl it up.
Yes.
Okay.
That cupping action, or we say tongue taco. Yes. And then she can extend it briefly, like when you see her like.
Right,
she can her tongue out
she'll
and then
stick
it comes
it out
back
and
in.
pull it in.
But to keep it out for breastfeeding and then to keep it cupped, she's not able to do that.
Okay.
I haven't seen her cup her tongue at all.
She can lift it up.
But she's
But
not
she
doing
can't
that, like
do this,
curling.
yeah.
Okay.
Not that I've ever seen her do.
Yeah, I know. I don't mean to gag you. I'm sorry. Yeah. She's... all right.
You did really well. You're not fussy at all.
What other questions might you have?
No, it makes me feel better knowing that I wasn't, it's not in my head. Because I looked at her lip and I was like, I feel like that's really a really deep connection on her lip. I was like, it goes all the way to the tip of her lip. And
No, it definitely is. It definitely is. Now, I will